I think the biggest challenge was with respect to, medical device approval and device suppliers, because, it's one thing for someone to print them in their garage and donate them. And if something happened, it's one thing. But if we're an organization that's been knowingly breaking Health Canada policy, like that's obviously a no-go. So that was the biggest challenge. Was like, I can do all this stuff. We don't have an MDL. We don't typically hold an MDL. We don't typically focus on Class 1 devices. So, and of course, don't get into 2, 3, and 4. So that was where I was like, okay, shoot, how can I get these to people? Because I don't want to break any Health Canada policy. I want to make sure we're doing things properly. But I also know, and I know that this stuff will be approved, and I know that it's not dangerous, and I know X, Y, Z. So how can I make this happen? And the way we made it happen, and the reason that North York and Sunnybrook have been so awesome, is because if we're donating them to clinicians, they're making the call on whether to use them or not. So I don't like calling it a loophole, because it's not necessarily a loophole, but it's just about finding the right recipient for what you're trying to do that can use what you have, and not necessarily can only use them based on a promise of a certain regulation or something like that. I had a number of calls where people were asking to buy our stuff, and I had to say no because we don't have the MDLs, and I'm not willing to do that, right? So that's where I said, okay, well, how can we do with what we have now? How can we get devices to hospitals? That was just it. That was the only focus.